7:30 a.m. Between episodes, the conversation never stops. Our Ask the Doctor Facebook community is where your questions may spark debates, where stories connect us, and where knowledge is shared, not hoarded. And if you prefer to stream on your time, the CNC3 website makes us just a click away. No lines, no waiting rooms, no remote wars. And if you're a reader, my weekly column in the Trinidad Guardian takes you behind the headlines, where medicine meets meaning and public health meets real life. This isn't just another program, it's people-powered health. It's about turning questions into clarity and doubts into decisions. So tonight, lean closer, ask bravely, and remember, there are no silly questions, only missed chances to understand. This is Ask the Doctor, your prescription for clarity, connection, and care. Let's start with the doctor's capsule. There were some tragic accidents this week, one involving a PTSC bus which claimed 2 lives and then subsequently one on the Beetham Highway, leaving us in shock and deep sorrow. My heartfelt condolences go out to the families, friends, and loved ones of those who lost. May you find strength and peace in this unimaginable time. It's a reminder that road safety is a responsibility we all share. And in memory of those lost, let us recommit to vigilance on the roads, obey the speed limits, ensure our vehicles are properly maintained, and always drive with alertness and respect for life. Further afield, health authorities have reported that 300 vials of fentanyl injection, which is a synthetic opioid, very powerful, were missing. 300 vials of fentanyl. And that's used exclusively under medical supervision in places like the theaters, by the operating rooms, intensive care units, and palliative care teams. And that has a lethal potential, that particular drug, even in microgram doses. And that makes this situation particularly dangerous, because it's not just dealing with a missing shipment, it's a potential disaster. Fentanyl is up to 100 times more potent than morphine. A single vial, if diverted and misused, especially when mixed into street drugs, could be fatal to many. And misuse of fentanyl is the leading cause of opioid-related overdose deaths around the world. And while we haven't seen confirmed fatalities here, the public health risk is still very real and urgent. And that's why authorities must move swiftly and transparently. The public should remain alert, and anyone who would encounter this drug should immediately contact the Trinidad and Tobago Police Service, because this situation is a stark reminder that healthcare's fragility includes its supply chain. So on a lighter note, among the 6,000 new words added to the latest edition of the Cambridge Dictionary, some were born from social media trends. Imagine this is Generation Alpha, using words like skibidi, which could mean cool, bad, or it could just be used in a nonsensical way. So it's good if you're thinking about your children and grandchildren. Would you believe another word, delulu, which is a playful take on delusional, and tradwife, which refers to women who embrace traditional roles, have actually appeared in this Cambridge Dictionary. So the manager says that these words with staying power will actually add use on the internet. So the dictionary's lexicon program manager has been thinking about these new words because this culture is changing the English language. Delulu, he must be Delulu. And the effect is fascinating to observe and capture in the dictionary. Going to the United Kingdom, the UK's medicine regulator has approved the first immunotherapy and to be licensed to delay the progression of type 1 diabetes in persons who are in the early stages of the disease. When we talk about type 1, most persons may be younger or slender in build, and there is immune-mediated destruction of the cells in the pancreas, so they have a deficiency of insulin. And this new drug may be given to adults and children aged 8 years and older who are in stage 2 of the condition and are at a high risk of progressing to stage 3. 3. And at that point, when you reach stage 3, you usually have blood sugar problems and then would be formally diagnosed with type 1 diabetes that requires lifelong insulin treatment. So fascinating research, cutting edge in the UK, and we look forward to this being an option in the region. And in the United States, there were some new blood pressure guidelines this week from the American Heart Association and the American College of Cardiology. It's the first major update since 2017 when we're talking about hypertension. Doctors are now being asked to act earlier and more aggressively. And the target for your blood pressure, 130/80 millimeters of mercury. If it's elevated, You'll first be guided towards lifestyle changes, as always, fruits, vegetables, nuts, peas and beans, and of course, low salt. If things don't improve within 3 to 6 months, a medication will likely be added. A big shift to the guidelines is that alcohol is no longer seen as safe in moderation. We used to say perhaps a maximum 1 drink per day in women and 2 drinks in men, and no amount of alcohol is safe. The new gold standard is abstinence, because research consistently shows that alcohol raises blood pressure. And high blood pressure, as we know, hypertension, is called a silent killer because it has no symptoms. It's the single most important preventable cause of premature death. Leads to heart disease, stroke, kidney problems, and even dementia. Nearly half of persons in the United States and a growing number of us here in the Caribbean are affected. So just some tips on what you can do. Keep your blood pressure, if you can, under 120/80. That dietary approach to stopping hypertension, fruits, vegetables, whole foods. You're trying to cut back on salt. Salt is a 4-letter word, as we say, when it comes to hypertension. And you're trying to keep moving at least 150 minutes for the week. So that's about 30 minutes most days in a week. Running, walking, biking. We see you when you're Zumbaing. And manage stress and maintain a healthy weight. Think twice about alcohol. And in short, early action, stricter goals, and zero tolerance for that 1 drink. That's a new prescription for living longer, healthier, and sharper, and even into an old age. It's time for a short break, and when we return, there'll be more on Ask the Doctor. Don't go anywhere.
This is a serious problem in Trinidad. What is diabetes?
There are 2 forms. Diabetes type 1, when your body stops producing insulin. Type 2 diabetes is a result of poor lifestyle. Type 2 diabetes is associated with being overweight, having high blood pressure, at higher risk for heart disease. It is a very serious problem.
Do not wait until it's too late. Let Omega XL be the first step in the right direction.
Get your Omega XL today. Live long, stay strong with Omega XL.
Introducing CTS College's Early Learners Academy, our physical school with a nursery, daycare, and preschool. With qualified and experienced staff, modern classrooms, and the latest teaching methods and technology, your child would get the personal care and education they deserve. Activities include potty training, storytelling, phonics, craft, academics, and field trips. Enroll your child today at CTS College's Early Learners Academy.
Whether you're an athlete, a business professional, or simply someone who values their health, Omega XL can empower you to keep doing what you love. Don't let joint discomfort hold you back.
Live long, stay strong with the XL brand.
Muscle Russell.
Cricket is Caribbean passion, pure energy and pride. That's why Flow is proud to be the official telecommunications partner of the Trinbago Knight Riders for CPL 2025. Win tickets to TKR home matches or an all-inclusive finals home line when you sign up for the Everything You Need plan. Plus, enjoy 25% off for 6 months. One identity, one beat, one rhythm. Visit discoverflow.co to learn more. Promotion approved by the NLCB.
Football Basket Marketplace is celebrating our 34th anniversary for the month of August, and you're invited. Enjoy massive deals like mince beef, 5 pounds to $99. Cow heel, 5 pounds to $79.95. Nestle cream milk, 4 for $54.95. Crown, 8 kilograms rice, $69.99. Come and shop to win one of our 34 shopping sprees. Big giveaways and free hampers to be won. Shop, save, and celebrate only at Food Basket Marketplace, Arriba, Shagwana, Shafre, and Goville. Food Basket, where shopping is a pleasure and the price is right.
Hello, Trinidad and Tobago. Have you noticed the XL products at your local pharmacy? Endorsed by cricket star Andre Russell and many more, these supplements represent the pinnacle of natural health solutions. Trusted for their efficacy and purity.
302 रूम पूछ रहे थे. 302.
The drama unfolds on Uttaran. Don't miss a moment. Weekdays at 6 p.m. only on CNC3.
Welcome back to CNC3's Ask the Doctor. It's time for a fan-favorite segment where the tiniest voices share the biggest truths about health. Each week we hear from the real experts, the children, who tell us what they think about eating right, staying safe, moving more, and taking care of our amazing bodies. It's honest, it's funny, and sometimes downright profound. But as always, it's straight from the heart. Feel free to send your videos of school-aged children discussing these health-related themes to Uncle Rajiv at 800 CNC3. Let's have a look at this evening's Kiddies capsule.
Take 6 simple actions to keep flu away. 1. Get your flu shot. 2. Cover coughs and sneezes with a tissue and dispose properly. 3. Wash your hands. 4. Stay home if feeling unwell. 5. Avoid close contact with a sick person. 6. Avoid touching eyes, mouth, and nose. My name is Tyree Cape. I attend Lendor Hindu Primary School, and this is your Kiddies capsule. Good night.
Good evening. Okay, so if we were to research the definition of a smile, you'd find that it's said to improve mental health by releasing mood-boosting chemicals such as endorphins, dopamine, and serotonin, all of which help to reduce stress and anxiety levels. However, if you were to ask a person who is struggling with depression, they'd tell you that the smile brightens their day and shifts their entire mood, from them feeling alone and helpless to having hope in their situations.
A smile is contagious. A smile is free. A smile can be given effortlessly. We all dream of a world full of love, peace, and happiness. So let's all do our part and share a smile. You never know, you can be making someone's darkest day a bit bright.
Now look at this beautiful smile. I mean, how can you see a smile like this and not want to share one too? I'm Abigail Prudhomme.
I'm Bella Prudhomme.
And this is your Kiddies Capsule. Bye.
Hello, my name is Vincent, the Diet and Specialist Learning Center. I want you to know that keeping our environment clean keeps us healthy. When we dispose of trash in a sanitary way, we keep away pests such as flies, roaches, and rats, which can spread diseases and get us sick. A clean space means we care for each other, our families, and even our pets. A clean environment means healthy living. That was your Kiddies Capsule. Have a great night.
It's always a treasure trove of information, so remember to smile, be careful, practice good hygiene, and as a reminder, COVID never went away, so avoid those 3 C's: closed, crowded and close contact settings, and it seems prudent to consider wearing a mask if you're going into a high-risk environment such as a hospital, particularly in those persons who are vulnerable. If you have extremes of age, if you're pregnant, and if you have chronic diseases such as diabetes, hypertension, heart or kidney disease. It's time for a short break, and when we return, the Medical Minds segment awaits.
Welcome to RD Good Health Medical Center, your trusted partner in total wellness. We're conveniently located at 34B Southern Main Road, Montrose, Chaguanas. From consultations to diagnostics, vaccinations, and women's health, we're here for you. Our cutting-edge tech includes a 124-slice CT scanner, X-ray, ultrasound, and full lab services to ensure you get everything under one roof. Plus, our dialysis center offers expert, affordable care. RD Good Health, caring for you every step of the way. Contact us at 223-3730 or WhatsApp 725-4663 today.
With the cold and flu lurking around every corner, keeping your immune system strong allows you to live the life that you want every day. Discover BioStrath Immune Health. BioStrath Immune Health is a unique plasmalized yeast product that enhances the absorption of essential micronutrients, ensuring that your body stays resilient. And now enriched with zinc, it is your go-to support for immunity. Staying vibrant and healthy just became a whole lot easier. BioStrath Immune Health. Get what you need naturally.
New promotions. Arima Door Center number 4, Cleaver Road, Arima is having new arrivals and new prices. See new security steel doors, $1,900. A variety of door handles starting at $60. Bathroom vanity sets, $1,700. So hurry to Arima Door Center. This Java bring the whole family to La Vega Estate, Trinidad's #1 family-friendly destination. Open daily, including weekends and public holidays. La Vega is more than Trinidad's leading garden center. It's packed with fun for everyone. New this season, thrilling ATV tours for the adventure seekers. Plus 2 large pools, fishing, nature trails, playgrounds, and more. Camp under the night sky. Make a booking for an unforgettable family getaway. Call or WhatsApp 714-5969 to plan your next adventure today.
What should your parents use to fight inflammation?
Omega XL.
What do you think I should take, babe?
My mommy and daddy should use Omega XL to fight inflammation.
Shop Southern Food Basket anniversary specials. Chicken breast tenders 5 pounds for $149.95. Chicken wings 1 kg $34.95. Goat stew 4 pounds for $100. Grill Master 2 pounds 2 for $99. Rich Port vegetable oil 900 ml 2 for $19.95. Perdix nuggets 300 grams $19.95. With every $300 you spend at any Southern Food Basket, you can qualify to win a brand new Suzuki Grand Vitara. Much more prizes to be won, including Caribbean getaways, staycations, and shopping sprees.
Inside every cell is a metabolic engine, AMPK. Berberine Plus helps ignite that engine, turning sugar into energy and fat into fuel. Whether you're managing sugar or trimming fat, Berberine Plus supports your goals naturally. Berberine Plus, now available at Pennywise and leading pharmacies nationwide.
Do you suffer from pain in your back, knees, or joints and need effective pain relief? Get your life back with Omega XL, a natural, safe, anti-inflammatory supplement. This small soft gel has up to 22 times more omega-3 free fatty acids than fish oil and is backed by 30 years of clinical research.
I can just tell you from my experiences, there's nothing like this Omega XL.
Live the life you deserve and get the relief you need. Get Omega XL now at your local pharmacy.
Welcome back to your #1 show for news, views, and interviews of all things medical. Ask the Doctor. We're live on Thursdays with a rerun on Friday at 11 a.m. or Saturday at 11:30 a.m. When we're talking about loud noises and fireworks, or we're speaking about loud noises, and if you're in a band, including a steel band, they may be associated hearing loss. So we have asked our renowned ENT surgeon, Dr. Richard Kunulal, to guide us through the nuances of this particularly vexing and common problem. Let's have a look at this evening's Medical Minds.
My name is Dr. Richard Kunalal, and I'm your ear, nose, and throat specialist. Today I would like to speak on a little something that is close to the heart: fireworks and loud noises. You might love a good fireworks show or party playlist, but while we are celebrating, our pets might be suffering quietly. Dogs, cats, and even birds experience sound very differently than we do. Humans hear sounds in the range of 20 to 20,000 hertz, but dogs, they can hear up to 45,000 hertz. Cats even higher, around 64,000 hertz. That means they're picking up frequencies we don't even register. So when a firework explodes or music blasts at a party, the sound might not just be loud to them, but it might even be painful. Now, here's where it gets serious. Noise trauma in pets is very real. Just like humans, animals can suffer from tinnitus, which is ringing in the ears, hearing loss, panic attacks, even seizures in extreme cases. And the worst part, they can't tell us anything about it. They just hide, tremble, bark uncontrollably, or shut down completely. So, what can we do? Here's a few simple strategies. I always recommend to pet owners, especially during holidays or when you know there'll be noise. Create a quiet zone, a safe enclosed space, maybe in a bathroom or closet, and this can help buffer sound. Use calming tools, soft music, white noise, machines, or even pressure wraps like thunder shoots can reduce anxiety. Soundproof if you can. Close windows and curtains. Add blankets or pillows around crates. Every layer helps. Desensitize early. If possible, expose your pet gradually to low levels of sound over time so they can build up tolerance. Remember, our pets rely on us to protect them. Just because they don't cover their ears or say ouch doesn't mean they're okay. And from one doctor to all the pet lovers out there, good ear health isn't just for humans. Better hearing, better comfort for the whole family. Let's make it happen.
And we say a special thank you to Dr. Richard for his love, support and service. No stranger to the Medical Minds segment on Ask the Doctor. Blessings to the entire Kunulal family. And it's a reminder that silent fireworks would be a step in the right direction at every festival in this country. It's time to put your medical knowledge to the test, and our wonderful audience members are ready to take on the challenge. The giveaway segment with the compliments of Great Health Works is coming up next.
This is a serious problem in Trinidad. What is diabetes?
There are two forms. Diabetes type 1, when your body stops producing insulin. Type 2 diabetes is a result of poor lifestyle. Type 2 diabetes is associated with being overweight, having high blood pressure, at higher risk for heart disease. It is a very serious problem.
Do not wait until it's too late. Let Omega XL be the first step in the right direction.
Get your Omega XL today. Live long, stay strong with Omega XL.
You can tell from the crowd who's up next. It's Trinray's star player, whose world-class stats put him in a league of his own. Trinray's risen to become a true force to be reckoned with. With an unbeaten Carry A rating, they boast a strong solvency and A-class service. Ladies and gentlemen, you're witnessing Trinray's financial and technical strength at its best.
Trinray, premier insurance coverage for less.
Get the best in affordable eyewear. Frames with blue filter lenses and eye exam, $399. Single vision lenses with transitions on designer frames, $799. Progressive transitions with designer frames, $1,399. Happening only at Seaview Optical. Affordable eye care for everyone.
Whether you're an athlete, a business professional, or simply someone who values their health, Omega XL can empower you to keep doing what you love. Don't let joint discomfort hold you back.
Live long, stay strong with the XL brand.
Muscle Russell.
Do you suffer from pain in your back, knees, or joints and need effective pain relief? Get your life back with Omega XL, a natural, safe, anti-inflammatory supplement. This small soft gel has up to 22 times more omega-3 free fatty acids than fish oil and is backed by 30 years of clinical research.
I can just tell you from my experiences, there's nothing like this Omega XL.
Live the life you deserve and get the relief you need. Get Omega XL now at your local pharmacy.
It's giveaway time with the compliments of Great Health Works. A special hello to Joseph Sendel and the rest of his excellent team. So the numbers are on the screen, and as a reminder, when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. So we would like you to tell us the answer to a best out of 4. What is the most common site for an ectopic pregnancy? So normal pregnancy occurs when a fertilized egg implants into the womb. So an ectopic occurs outside of the womb. Is it the ovary, A, B, cervix, C, fallopian tube, or D, the abdominal cavity? I believe we have a caller on the line. Hello and good evening.
Hello?
Welcome, sir. It's a pleasure to have you on the air.
The answer is C, fallopian tube.
Congratulations, sir. The first caller is also the winner. Well done. So the fallopian tube remains the commonest site to have an ectopic pregnancy, which means that it occurs outside the womb when the egg is fertilized. And of course, since the fertilized egg is now in the tube, it may rupture, and it creates actually a true medical emergency in those affected women. Congratulations, sir. Have you tried these supplements before?
No, this is the first time I'm testing.
And thank you for being a part of our Ask the Doctor family. There's a first time for everything. Stay on the air, and we'd want to take some of your personal information. What a pleasure to have you. And we look forward to having some more of your questions and hopefully answers on the open forum that's coming up next.
This is a serious problem in Trinidad. What is diabetes?
There are 2 forms. Diabetes type 1, when your body stops producing insulin. Type 2 diabetes is a result of poor lifestyle. Type 2 diabetes is associated with being overweight, having high blood pressure, at higher risk for heart disease. It is a very serious problem.
Do not wait until it's too late. Let Omega XL be the first step in the right direction.
Get your Omega XL today. Live long, stay strong with Omega XL.
Welcome to ABC Doors and Windows, TNT's #1 destination for the best quality and widest variety of doors and windows. Enhance your space with our premium wooden, steel panels, fiberglass, and steel security doors, complemented by our aluminum, UPVC, and steel windows. Shop for the best quality and service at ABC Doors and Windows. Visit our impressive showroom at 1 Chancatrace, El Socorro South, or call 638-7184 to get started. Trust ABC for a better choice.
Hello, Trinidad and Tobago. Have you noticed the XL products at your local pharmacy? Endorsed by cricket star Andre Russell and many more, these supplements represent the pinnacle of natural health solutions, trusted for their efficacy and purity.
Big ambition starts with clear vision. This back to learning season, Rare Optical has eyewear packages for every learner. For kids 15 years and under, get a free frame with lenses starting at just $495. Scholars, it's time to level up your look with frame plus lenses from $750. Lifelong learners, purchase any frame $1,099 plus and unlock up to 30% off premium lenses like Eisen, Varilux, and Transitions in 8 bold colors. And don't miss your chance to win a $1,500 learning supply voucher or transition lenses when you purchase any eyewear package. Ferrera Optical, big ambition, clear vision. Visit us in store today. This promotion is NOCD approved.
What is BioStrath and what makes BioStrath unique? BioStrath is a general wellness elixir. BioStrath is based on fermented Strath herbal yeast. It is produced over a 2-month period by feeding friendly yeast cells with a mixture of herbs and nutrients. This process, which the yeast cells undergo, allows them to absorb 61 micronutrients, which can then be easily transferred to your body for your general well-being. Because of this process, BioStrath makes all nutrients more bioavailable to your body. This makes BioStrath unique. With BioStrath, the body can absorb far more of the nutrients from your diet and supplements, giving the body superior benefits. Improve your overall health and well-being with BioStrath Premium Elixir for every age and every stage of life.
Welcome back to the open forum of CNC3's Ask the Doctor, live on Thursdays with a rerun on Friday at 11 a.m. and Saturday at 11:30 a.m. A special hello to Miss Denise Batiste from San Juan, always locked into this show. And of course, the entire Thomas family, Deanne and Denise Thomas, originally from Gasparillo, moved to San Fernando. They do not miss an episode. A lovely family, the Thomases. And belated birthday blessings to Miss Sita, or rather Jagdeo from Bamboo. She is a firm fan and believer in Ask the Doctor. Our first caller hails from Maraval. Thank you for waiting. Good evening.
Hello.
Thank you for joining us, sir. It's a pleasure to hear that voice. Very distinguished as always.
Yes, sir. What I was listening to you, and I was watching sort of a documentary from Mayo Clinic.
Yes.
And it kind of repeated, exactly what you said, that it said that COVID never went away.
Yes.
It's been lingering in different variations for the last few years. And they said that they were talking about all the different antibiotics, especially for upper chest inflammation.
Yes.
And they said that out of all the antibiotics, different antibiotics work for different people, which I understand. And they said one of the antibiotics that is used and is overused is levofloxacin for upper chest infection. But they said it has probably been overprescribed in America more than any other antibiotic for infections like that. And you have to be very careful when you take over-the-counter antibiotics without going to a doctor. And I think a lot of people in Trinidad have that problem. Let me know what you think.
Well said, and thank you very much for sharing those insights, because there is an increased risk for these chest infections in persons who may be recovering from a virus. So many of these, such as the flu or COVID-19, are caused by viruses, so they do not respond to antibiotics, which were meant for bacterial infections. Unfortunately, because of misuse and abuse, there is an environment of resistance is being created. And this particular one, called levofloxacin, has been used for urinary, chest, and even skin infections. And because the fact that it's available in many of the pharmacies without a prescription, this has created an environment in which is less effective, and of course these organisms are now resistant, particularly if you're trying to manage a viral illness in which antibiotics will not work. So fluids, bed rest, paracetamol for symptoms, and sometimes if you're having some respiratory type problems due to COVID, dexamethasone, especially in those who are having low levels of oxygen or had to be admitted to hospital, was found to reduce the risk for complications. So COVID was never over. It was just that the world thought it was time to move on for different reasons. Probably financial was the biggest issue, and be extra careful, especially in the light of the holidays. The world is a global village, and we have the entry and exit of persons into the country, and one can expect there will be an increased risk of transmission of viruses such as COVID. So avoiding those closed, crowded, and close contact settings, and don't be embarrassed to consider high-quality mask, such as an N95 in such environments. That's an excellent first question to open the batting. We head to the Southland. San Fernando, good evening. Hello.
Hi, good day, Doctor.
Thank you for joining us. A pleasure to hear your voice, ma'am. Go ahead.
Well, I'm calling to find out about what you think about parasite cleanse, taking that.
Pardon me, ma'am?
Taking parasite cleanse and...
Parasite cleansing, sure.
Yes.
Yes.
What do you think about that?
Thank you very much for taking the time to call in. That's a fantastic question because it's very relevant to many people who may present to the doctors who practice mainstream medicine but would have gone to some alternative practitioners. Sometimes a drop of blood is extracted from the finger and then you see a host of organisms on a screen, and it's difficult to diagnose that just on a drop of blood. A traditional blood test, if we're thinking about parasitic infestations, some persons may have symptoms like a change in bowel habit, weight loss, and you would want to formally diagnose that perhaps on a stool sample or in conjunction with a gastroenterologist. So when we're talking about parasites, especially with travel, this is a potential risk. However, alternative practitioners sometimes would show you things on a screen, and it's difficult, or I would venture to say virtually impossible to say that somebody is infested with parasites just on the basis of a finger stick test. So, and sometimes, of course, it comes with a bill attached because they want to sell remedies. Have a chat with your doctor. Sometimes we used to use worm outs, as they are known, in terms of local terms, or some medications to actually eliminate some of these worm infestations, and perhaps once a year. It's recommended by doctors, particularly on the basis of blood tests or even, as I mentioned, a stool sample. So I would want to take that with more than a grain of salt. If you've been told that you're infested, have some questions as to how can you be sure? Where exactly would the parasites be? Have you done scans? Do I need to do a test by a gastroenterologist involving perhaps the camera called a colonoscopy or an endoscopy? And how will I know if I've been treated appropriately? Parasitic infestations have a specific group of symptoms. They're very real and relevant in clinical practice, but it is frequently not diagnosed properly or misdiagnosed by alternative practitioners, and sometimes just to sell some remedies that are available over the counter. So I'd want you to be extra careful about some of these claims that continue to be disseminated on mainstream media. We're back to the phone lines. Good evening. Thank you for joining us on Ask the Doctor.
Hello,
Morva on the line. A pleasure to hear your voice, ma'am. Good evening.
Good evening.
Morva is in the house.
Just calling to find out
yes, ma'am.
About sickle cell disease and kidney disease also. I found out I have type 2 kidney disease.
Yes,
but the thing is, my hematologist haven't given me anything about any information pertaining to that problem. So I wanted to find out what can I do to prevent the kidneys from deteriorating, because it seems like you have to be in stage 3 or 4 or 5. Then they will tell you that, okay, don't eat this or don't do that, or you have to do your research for yourself.
Yes, ma'am. Thank you very much for taking the time to call in. Very relevant question. And for the sake of our viewers, sickle cell disease, as we know, is a genetic or inherited blood disorder in which there are abnormalities involving the red blood cells. Some people may have a trait or they may have a full-blown form of the illness in which you have a lower level of immunity, you have problems with your spleen, you're prone to painful crises, infections in the chest, and because of problems with blood flow in your vessels, there may be damage to the kidneys. There is a specific entity called sickle cell nephropathy, so it may occur as a complication of the sickle cell, or if you have accompanying illnesses such as diabetes, which is a commonest cause for chronic kidneys in the world, hypertension, sometimes medications used for pain. These are all part of problems which may damage the kidneys. So whether it's due to sickle cell or another entity, it's important to be monitoring at this stage, ensuring that your blood sugar, your blood pressure, cholesterol is under immaculate control, stopping smoking if you do so, having a chat with your doctor about a referral to a dietitian is still prudent. There are stages when we discuss chronic kidney disease. You may not need to see see a specialist called a nephrologist at this point, but you're doing blood investigations perhaps every 3 months, having a look at your urine. A sample is sent to the lab to examine under the microscope. Is there blood, protein, or signs of infection? Have you had the level of protein in your urine assessed? So there is a specific test for that to determine whether there are microscopic amounts of protein. And as an aside, that should be an annual test for all persons with type 2 diabetes. And in those with type 1, you're checking it annually after 5 years from the diagnosis. So looking for microscopic amounts of protein. The term is microalbuminuria. So I want to congratulate you for having the foresight. You don't want to see the progression of the disease from stage 2 on to the end stage known as stage 5. So for once more, for the sake of our viewers, stage 1, based on your blood investigations, if you've had changes on an ultrasound scan of the kidneys, and it may proceed to stage 5. In the latter stages, you would want to see a nephrologist or join a renal clinic at the hospital to ensure that you are managed appropriately. The kidneys play a role in maintaining your blood count. And of course, if you're battling sickle cell, I know that that's also something that would require blood transfusion and monitoring. So you'd want to liaise with your hematologist whether joint care is needed with your primary care doctor. And of course, if there is a progression, there may be some medications to slow such. So there are some drugs which are approved in persons with chronic kidney damage to actually slow the progression through stages. And they were originally meant for those with diabetes, and they have been found even in a non-diabetic person to assist in this. Perhaps they haven't been studied enough in those individuals with sickle cell nephropathy or kidney disease induced by sickle cell. So you're managing this stage 2 with healthy living, diet, you're keeping active in terms of physical activity for 30 minutes most days in the week. You're being vigilant about sickle cell crises and admissions to hospital. You're looking at some of the other problems which may tend to accompany, and you're chatting with your hematologist about frequent blood and urine investigations, and even an ultrasound scan of the kidneys if that has not been done. Our next caller hails from Charfleur. Good evening and welcome to Ask the Doctor.
Hi, good evening. This is Doctor.
Yes, sir. Thank you for joining us. You're on the air.
Okay. First of all, I did not call to get a diagnosis or to find out anything. What I actually called to do was just to compliment you on the job that you were doing. You are doing a phenomenal job, and I really hope that CNC keep doing what they are doing. Having you on this program, your program is very informational.
Yes, sir.
You continue to.
Hello? Hello. Oh, it sounds like we lost that call. And thank you once more, sir, for your love and support. And it is an honor and privilege to be a part of Ask the Doctor. And we need this sort of boost and lift. As long as CNC3 wants me here, I am going to be present. I am going to bat for you. Thank you for that, sir.
Yes.
So you're back on the air. Thank you. Please, go ahead.
Yes, so I want to send shout out to Dr. Ayers, Nurse Paul from San Grande Hospital.
Yes.
And there's another doctor, but I can't remember her name, but Dr. Mori and the staff from the oncology.
Yes.
Those guys up there is really, really doing a fantastic job. So I really hope that, a lot of times people complain about the healthcare, but you got to try Sanigran. You got to try Sanigran. So, Doc, good luck. I pray God that you have longevity and you continue doing what you're doing. May you be blessing your going out and blessing your coming. This is Uncle Eric signing off. Good night.
Thank you. Thank you very much, and reciprocations to you and your family. Thank you, and it has been a pleasure to hear your voice. And once more, it's a hidden gem in the East at Sangre Grande Hospital. Kudos to the doctors and nurses there, including my cousin, Dr. Darren Dukiram, the head of accident and emergency at that beloved unit. We're back to the phone lines. Good evening. Thank you for joining us. Hello. Tobago is on the line.
Yes, hello, good evening, doctor.
Welcome, ma'am.
My son was diagnosed with G6PD. Can you explain it a little more for me, please?
Pardon me, ma'am. It was G6PD, you said?
Yes.
Yes, thank you very much for taking the time to call in. What an excellent question. And perhaps it is tied to our discussion on sickle cell disease, because this falls under the umbrella of hemolytic anemias, in which your red blood cells are broken down. They have a shorter lifespan than usual. So red cells have a lifespan of about 120 days or 4 months, and these red cells have a shorter lifespan. G6PD is an enzyme that is lacking. So G6P, it's an enzyme that is involved in the production of the hemoglobin. So you find that these cells have a shorter lifespan, and it's an inherited illness too, just like sickle cell or some of our patients with thalassemia. It's important that you get a list of certain triggers that may cause an increased breakdown of the red cells and predispose him to anemia. So this weakness, tiredness, shortness of breath, or palpitations that many persons with a low hemoglobin level would experience, there are certain triggers, including certain foods. I remember we used to talk about a type of bean, and it's seen in persons of Mediterranean extraction. So you're looking at triggers like infections that may cause, because he's lacking this particular enzyme, and that is abbreviated, I think it's glucose 6 dehydrogenase and G6PD. And if you have problems with your blood count, it's induced by the fact that he's lacking the enzyme. You want to monitor in consultation with a hematologist or a blood specialist, and also be vigilant, because it's a genetic illness, so this may affect persons in a family. There are certain triggers that you would want to avoid, certain changes to the diet or infections, and sometimes if he's prescribed medications by a doctor, and you may read actually the package inserts that persons who are battling G6PD need to be careful about those particular drugs. Fascinating question, because it involves managing triggers and, of course, monitoring the blood count and other investigations. And there's no reason why he cannot live a normal life. Of course, one of the hidden effects of these hemolytic anemias, in which the red cells are damaged, is that these pigments may predispose persons to getting gallstones. Would you believe? Most of the people who battle this particular problem in the gallbladder would have crystals of cholesterol, but there is a unique situation in those individuals with sickle cell or G6PD, in which the red cells are broken down, the pigment is released, and they have bile pigment type stones. So pain in the right part of the tummy, nausea, vomiting, sweating. Sometimes you may be sent for a scan of the tummy and find that you are battling gallstones and require surgical intervention. Our next caller hails from Laventille. Good evening and welcome to our show.
Hi, Doctor.
Welcome.
It's always a pleasure hearing you and seeing you on television.
It's an honor. Thank
you,
ma'am.
My problem is, right, I fell before the COVID, right?
Yes, ma'am.
And I fell on my left side. 63 years.
I'm sorry to hear that.
Right?
Yes.
And I fell on my left side. But since then to now, I'm getting so much of severe pain in my waist and my thigh. Sometimes I get pain going right down to my leg. So could you tell me what it is causing it?
And thank you for taking the time. Thank you, and it's a pleasure. And hello to all of our firm fans and viewers in Laventille. I know Mr. Carlton Warner is always locked on. And that particular situation with lower back pain represents a common reason for people actually presenting to an emergency room. And it's been over 5 years, so since pre-COVID, that you had this fall that may have triggered symptoms. And it may be muscular in origin. Sometimes they're wear and tear to the lower part of the back. There may be degenerative changes. And if you're having those bones that become closer together and impinge on a nerve, there's nerve root impingement. It travels down the buttock and legs. The medical term is sciatica. Now, I'm not attempting to make a diagnosis, so I always say it's just to nudge you in the right direction, that there may be some involvement to the muscles, the joints, the tissues, but it also makes me wonder if there is nerve impingement. So if you're losing weight, if you've had a low blood count, a history of cancer. If you've had a fever, your doctor may want to consider doing a scan of the lower part of the back called the lumbosacral spine, and particularly an MRI would be ideal to not just look at bones, but also the softer tissues and nerves. We often use basic anti-inflammatories, but have a chat with your primary care doctor whether you need to step up your game to something that may help nerve root pain, whether or not you need a scan, perhaps a referral to the physiotherapist and even a neurosurgeon to alleviate symptoms. It's a vexing issue because it may evolve into chronic pain, and I certainly wish you all the best in getting some sort of ease. And so the management involves a multidisciplinary team. You're working with you at the center of the clinical encounter, your primary care doctor, to determine if you need some basic investigations, not just an X-ray at this point, even an MRI scan, and then subsequently a referral to the physiotherapist or even a neurosurgeon. And there are some excellent teams at Port of Spain General. It's time for a short break, and when we return, there'll be more of your questions and answers on the open forum. Don't go anywhere.
की जुबान पर सिर्फ एक ही नाम है, इच्छा, इच्छा, इच्छा। तपस्या का तो नाम ही किसी को याद नहीं है। कल तक जो तपस्या सबकी आंखों का तारा हुआ करती थी।
Uttaran brings the drama you love, weekdays at 6 p.m. on CNC3.
Welcome back to the open forum of CNC3's Ask the Doctor. The phone lines are burning up as per usual. Good evening and thank you for waiting.
Yes, my name is Merlin Rogers.
Yes, ma'am.
I wanted to know what has caused women to get ectopic pregnancies, have ectopic pregnancies.
Yes, ma'am. Thank you very much for taking the time to call in. That's an excellent question. And it's tied, of course, to the giveaway segment. So usually a fertilized egg would implant into the womb. And sometimes if that egg is fertilized and implants elsewhere, that term ectopic is used outside of the womb. And as we saw in the question, the commonest site is the fallopian tube. There's nowhere for the pregnancy to expand and develop. So the tube is removed. And of course, if there is a rupture, it's associated with severe abdominal pain and even catastrophic hemorrhage. It is a true emergency in the field of obstetrics and gynecology, and persons must be vigilant. In fact, it's been said that every woman presenting with lower abdominal pain of reproductive age should have an ectopic pregnancy excluded because of the fact that it is life-threatening and may require, apart from surgical intervention, admission to hospital, a rush to the theater, and of course removal of the affected area, that tube. So an ectopic pregnancy may occur as a result of scarring to the tube. Sometimes persons may have frequent infections. If you've had surgical intervention, there are some scarred parts of that tube called adhesions. And persons who have a particular problem called endometriosis may find that they are at an increased risk of ectopic pregnancies. If you've had a history in the past of such a problem, you are at an increased risk of having a future ectopic. So adhesions or scarring within that area of the gynecological tract if you've had recurrent pelvic infections, if you've had a past ectopic pregnancy, sometimes a person who smokes. So those are all risk factors for certain changes. And have a chat with your doctor. Perhaps if you're pregnant and having severe pain on one side, if you're having nausea, vomiting, it may be all symptoms associated with a normal early pregnancy. But that's why we always advocate an ultrasound if you're unclear. And the diagnosis must be made so that there will be an appropriate surgical intervention. There are different forms of treatment, but most times it's treated surgically rather than medically. Our next caller hails from San Juan. Good evening and welcome to our show.
Good evening, Doctor.
Thank you for joining us, ma'am. It's a pleasure to have you on here.
Good evening.
Yes, ma'am.
Yes.
Go right ahead. We're hearing.
Yeah, my name is Janet.
Yes, Janet.
I'm calling concerning my son.
Yes, ma'am. Listen on the telephone. Yes.
I think it's kidney problems he has. Okay. But right now his foot is very swollen.
Yes,
his foot is, both feet is swelled so bad. All over his body, all his belly swelling, his eyes getting puffy. He's not going to the hospital. All we trying to encourage him to go to the hospital, see a doctor.
Yes.
He's not going, but he's just swollen up. The foot feeling stiff. It's hard like a tree trunk.
Yes, ma'am.
And big. What do you think I should do with this boy?
Thank you very much for taking the time to call in. And I can hear the concern and distress of that of a mother. And certainly, if he's having swollen feet, and in fact, if he's having puffiness to the eyes, he needs a diagnosis. And I agree that one of the reasons could be problems with the kidneys. We spoke about the fact that sometimes there may be the leakage of protein out into the urine, and this causes the abnormal accumulation of fluid in not just the legs, but throughout the body, including the lungs, the tummy, and even the puffiness to the eyes. So that term is nephrotic syndrome, and it may be associated with a cluster of other abnormalities. If he has not had a recent blood investigation or a urine test, perhaps presenting to the health center closer to you might be an option, or a private physician. Doing some basic tests, perhaps apart from the kidney, a liver function is required. Looking at the thyroid function to determine if it's underactive. A simple pill may actually help with the fluid accumulation if he has hypothyroidism. Does he need a test on his heart? So presenting into hospital would, of course, be wisest, to the emergency room closest to you for not just those basic tests, but a chest X-ray, an ECG, a scan of the heart, a scan of the abdomen, just to determine the underlying reason. It's easy to say to take a water pill. So if you go to the pharmacy, if you go to sometimes a private physician, but the problem is likely to recur and may even be exacerbated by waiting. Thank you for taking the time to call in. I wish you and your family God's blessings. Gentle nudging, someone whom he trusts would need to sit and chat with this young man to determine the best course forward. But it seems like admission to hospital, apart from being cheapest, would also involve a multidisciplinary team. If he needs the cardiologist or heart doctor, if he needs the nephrologist or the kidney specialist, if he needs a primary care doctor, it will be done within the purview of a hospitalist. Thank you so much for taking the time to call in. It's unclear as to what is his reason, but what we know is that it is likely to worsen over time if we don't deal with this expeditiously. Wow, parting is always such sweet sorrow. And our closing quote is from that famed American writer, Ernest Hemingway. Courage is grace under pressure. So in fact, I think he used the word guts is grace under pressure. It captures the essence of true bravery. It is not loud or boastful, but the quiet ability to remain calm, composed, and dignified when circumstances are most difficult, whether it's in medicine, parenting, or public life. This quote, it's brief, but it reminds us that real courage is not the absence of fear, but the ability to carry ourselves with steadiness and compassion, even when the world feels overwhelming. I'll keep shining a light where shadows still linger and asking the questions that too often remain unsaid. Because in medicine as in life, the truth must be voiced to set us free. So walk boldly, breathe deeply, and choose joy, because health is not just the absence of illness, but the presence of courage, the presence of laughter, and the presence of love. My deepest thanks to the brilliant team behind the lens who keeps this heartbeat alive, and to my circle of light, Neela and baby Daniel, whose smiles remind me why every broadcast is worth it. And to you, our viewers, thank you for letting me into your homes, your hearts, and sometimes even into your hardest questions. Stay curious, stay compassionate, and above all, stay well. Until next week, may God's richest blessings be with you and yours. We'll see you then on Ask the Doctor.
Ask the Doctor is brought to you in part by Alive, by Nature's Way, distributed by H&J Enterprises, and XL Health TT, the official supplements of the CPL.
You're watching CNC3. The Morning Brew is brought to you by Omega XL. Live long, stay strong.